Good morning. Today is Thursday, August 15th. I'm Andrew Garcia, and you're listening to Wake Up with KERA News. Not much has changed weather-wise. It's still quite hot outside, and it's super important to keep safe while spending any time outdoors. Temperatures are expected to reach 102 today, but it'll feel a lot more like 108 or 109. Unlike these North Texas temperatures, though, the news changes with a bit more frequency, so let's get into it. Attorney General Ken Paxton is threatening to sue Dallas for the State Fair of Texas's ban on licensed concealed carry at the fair this year. His reasoning is that, according to state law, the fair can't ban firearms on government property. But Carissa Condoyanis, the State Fair's Vice President of Public Relations, says the ban is legal because the State Fair is a private nonprofit operating on the fairgrounds, not a government agency. Paxton says Dallas has 15 days to, quote, fix the issue before he pursues legal action. Leaders at Dallas Area Rapid Transit voted to compromise on a new reduced draft budget during a finance meeting yesterday. This comes after discussions over potential cuts, including bus routes, light rail expansion, and security resources. The board will now send the draft to DART's 13 member cities for input before a vote next month. A Mansfield hospital is home to some significant medical innovation. This comes with the transformative role of artificial intelligence in healthcare. KERA's Emmanuel Rivas explains how the hospital is taking steps to use the latest technology to benefit its patients.
Methodist Mansfield Hospital recently integrated an advanced artificial intelligence. Its purpose is to analyze brain scans that signal potential issues and alert medical teams in record times. Juan Fresquez is president of Methodist Mansfield. He explained the critical advantage of this technology to the Arlington City Council in July.
That speed gives us, they've said, an extra 5-10 minutes shaved off of the arrival time. Just like a heart attack, when the blood flow is blocked, you start to lose heart muscle. Similar with the brain, every minute, every second counts, you're losing brain cells.
Methodist Mansfield uses the AI software Rapid AI. Medical staff receive an alert on a desktop computer or through a phone app when anything is deemed abnormal. Although AI isn't new to healthcare, its applications are still evolving. Fresquez reflects on its journey from early computer-aided detection systems to today's complicated AI tools.
I've been in healthcare since the mid-'80s and have had an opportunity to witness the early rise of artificial intelligence. Fast forward now, the databases are much, much larger. The computer programs and algorithms now, there's some self-learning that occurs.
While AI promises incredible advancements, it also stirs debate. Concerns about AI replacing human roles are prevalent, but experts assure that technology is meant to assist, not replace. Mansfield Methodist Neuro ICU manager Rachel Cochran emphasizes the important role of AI.
The human physician is always going to be the one who is diagnosing the patient. This is not replacing that person. Healthcare is very holistic. We have to consider a lot of different things when we're considering treating people.
Others see important roles for AI in the medical field. AI's application may span from predictions in disease progression to the analysis of pharmaceutical research. Jambor Vishwathana is the Vice President for Minority Health and Health Disparities at the UNT Health Science Center. He also sees AI as an assistive tool, not a replacement.
At best, the AI tools will be assistive rather than replacing the professionals. With that said, I'm also very concerned about how this could affect different communities. It could affect some communities because they are not represented in the data.
But he does emphasize the importance of diverse data to ensure equity in healthcare.
Not all our communities get the surgical care that is necessary. So if the surgical models, AI models, are developed based on existing surgical data, it could affect some communities because they are not represented in the data.
Fresquez shares these concerns, harping back to the early days of breast cancer detection. The data collected then was only collected from white affluent women able to afford treatments. The data used then resulted in the misdiagnosis of women of color. But Fresquez stresses the importance of gathering diverse data to improve healthcare outcomes.
The more data you have, the sharper your data will be. The size of the database really, it kind of closes the gap in that standard deviation that occurs.
Methodist Mansfield is just one example of how AI is enhancing medical care and potentially saving lives. Currently, Rapid AI is in over 2,000 healthcare facilities worldwide. As for the future, Frescas is excited about the possibilities AI holds.
I'm very optimistic and excited about what the future holds. I wouldn't have thought this technology would be available. We want to make sure we don't wait too long to implement change. And so it's important for us to keep up with what's occurring in our industry.
That was KERA's Emmanuel Rivas reporting. If you looked up at the sky last night and could tell which planet was which, you will have noticed that Mars and Jupiter appeared super close to each other. They're really 350 million miles apart, but from the Earth's perspective, they appeared side by side in an event known as conjunction. Us Earth dwellers haven't had that perspective since 2018 and won't have it again for another couple of years. If you missed it, no worries. There's still plenty more to see in the night sky, including the tail end of the Perseids meteor showers, which peaked earlier this week. Back here on the ground, the National Cricket League gears up to host a major tournament at UT Dallas in October. The 11-day 60 Strikes tournament will feature the sport's biggest names, including 6 teams of internationally ranked players. I'm quite excited for this tournament. Every time I watch cricket, I still don't think I know exactly what's going on, but it is still a lot of fun to watch. That tournament will run from October 4th to the 14th. Rumor has it, there's a tribute concert happening tonight. Catch the Candlelight Concert Series, a tribute to Adele, at the First Presbyterian Church of Dallas this evening. For tickets and more information, visit kera.org/calendar. Thanks so much for listening to Wake Up with KERA News. I'm your host, Andrew Garcia. The show was produced and edited by Shardae White. For more news in your inbox, visit kera.org/wakeup. That's where you can subscribe to the Wake Up with KERA News newsletter and get more news and those good morning vibes you need from our colleague Catherine Hobbs. Connect with us on Facebook, Instagram, and Threads at KERA TX. Be sure to take it easy, and we'll see you tomorrow.